Anyways, moving on, prosthetic resurfacing. This is when the humerus is abnormal and the glenoid is normal. There are some surgeons that use this fairly regularly. Many people find this to have the unpredictability of a hemiarthroplasty versus a total shoulder arthroplasty. Maybe considering a young patient with isolated avascular necrosis on the humeral side and a good glenoid. That's an example where that might be valuable. In terms of prosthetic resurfacing, examples, humeral dysplasia, so in our younger patients, and then with a fracture, so we're just treating the humeral side. Again, it has been considered to be a good option, but it's not as good as other options that are available. So just like hemiarthroplasty or resurfacing in other joints, there are a small faction of surgeons that like it, but in general, most surgeons get a better result with something a little bit more definitive. Here's a couple of examples. Here's one device that does a partial resurfacing. Here's another one that does a resurfacing but has a tendency to overstuff the joint a little bit. And again, that's why, and you can, but it's very difficult to put a glenoid in that environment. Biological resurfacing, this is on here. You see there wasn't any questions on this, and it's because it's controversial. It's for younger patients. Again, there's been some good results, but when we looked at it, people at Harvard looked at it, and a few other groups did not reproduce the results that were seen down in Texas for whatever reason. That's just what we saw. Maybe it's because they have a special way of preparing the grafts, but if it's not reproducible among many centers, then it's probably not going to be highly reliable. And the graft that is typically used that had success was the fascia lata. These other ones have all been tried, but not with very good success. About 50% failure rate at 4 years, which is not very good. Biologic resurfacing, here's another really unusual example that you see here. This was a young patient that had collapse of the humeral head, and this surgeon went on to put in a fresh graft of bone and cartilage, and as you can imagine, it lasted for a short period of time, but then went on to collapse, and the definitive surgery of arthroplasty was needed. The results short-term were good, but as you see here, by 3 years, it was a 44% failure rate. By 5 years, it was a 50% failure rate. So that's not really a great idea, and it does potentially risk a more challenging total shoulder.
If you enjoyed this video, please consider leaving a like. We'd love to hear your thoughts and what you'd like to see next in the comments. Don't forget to subscribe to our channel and follow us on social media.